Medical malpractice exists everywhere. Even US is not exempted. Universities like Temple University, big universities, amputated a wrong limb for errors. To err is human. To correct is divine. I usually say that. So you can err. You can't make it zero, but you can avoid unnecessary errors. Imagine errors, forgetting gauze, forgetting scissors in a busy OR is common. So you can Google shocking, terrific. That there is famous site. It reads, I think, 10 horrific medical errors in humankind. I mean, wrongly taking out a kidney, wrongly, scheduling a patient for cardiac surgery while he's waiting, for cholecystectomy. So to err is human, but we should focus on prevention. Now, the WHO checklist, remember, timeout in the OR, it saved lots of errors. Checking the right dose, right patient, names, little things matter. Marking signs of surgery changed a lot. Especially double organs, double bilateral organs, you commonly err. So to avoid, measures to avoid unnecessary errors are important. We strive for that, but you can't make it zero. And avoid negligence as well. I mean, we hear accusations like fetus died because it is, World Cup football final day and everybody's watching TV and mother was laboring alone. Such things come. So, our profession is not, because we deal with humans, not with inanimate objects. Humans, especially obstetric, our colleagues are burdened double because they see double life. That's understandable. Plus, there are unethical contractors, unethical bankers, accountants, so and so. Very few percent, physicians may be unethical. Ethiopia is not immune like elsewhere, but that shouldn't cover the 95% good work physicians do, the sacrifice developing country practitioners make. That shouldn't be shadowed. That 5%. Unfortunately, our gowns are white. So if you put a drop of dark table from far, so the little error made once in a year, is visible from far because we handle humans. That for that family, this 5% is 100% when it knocks their door. So there is, of course, as you said, there is the effect of social media and non-medical content makers. So that should be balanced. We are humans, we make mistakes like anybody, but we don't learn years to kill people. Don't suffer all these 13, 14 plus years, spend our peak use time, enjoyment time in tough medical schools where you can earn 4 or 5 other degrees. We stick to this one career and profession for many years. And in the end, we don't intend to harm humans. I don't think any physician intends that way. If hurting or killing is an intention, there are 6-week, 5-week trainings of this elsewhere. No problem. People can join other organizations. They can't tolerate tough medical school for 13, 14 years. Therefore, we are lifesavers. We are suffering alleviators. It should be understood that way. We get fatigued when busy, when overwhelmed. We can err. But the good thing I saw from the decade practice chairing this board is usually good patients excuse, even if doctors make mistakes, nurses make errors. If you accept and apologize, usually they forgive. What our people, especially in Ethiopia, don't like is when you don't apologize. So if you err and sorry, this is my fault, I made this, I should have done this, they just say, it's okay. Don't do it again, don't hurt other people. I remember one patient, she had thyroid biopsy. Nobody told her it is a biopsy. She thought this is radical surgery. It is follicular RCA. So the resident thought the intern will tell her. The senior thought the resident will tell her. It's busy in the middle. Nobody told her. So 2 weeks, still the swelling is there. And she said, people, villagers, everybody was attending her, coming and asking her, wishing her recover fast. And some start to question, hey, it's still there. Can't you see it? What happened? Nothing happened, just more scar. Then she went to another doctor, as I said, and he explained her. Then she was so upset. And this is the cancer, imagine, follicular RCA. So I could have died. I thought it is gone. Nobody communicated me. She came. And we called the surgeon. He thought somebody told her. So to spend good time with our patients is important. Communicate verbally plus in a written way. You should document this on a chart. I remember doctors accused of not transfusing a patient while they gave 8 units of blood, but nothing is written. So finally, luckily, from Ministry of Health blood bank, it's easily traceable to collect how many units went out and patient, but we should document. Now, electronic medical recording is the era of documentation. Most of hospitals, including ours, are paperless now. Documentations are important. We should take time and document. Don't rush to finish the work. The work is always there. The OPD is always full. You can't finish it. You may finish your effort, but you can't finish those all numbers of patients. Therefore, always spend good time in documentation, in communication. Instead of seeing many patients, see those patients you saw in a quality way. You better stay longer than stay many years in jail. So spend time, work until late hours, but make sure you conveyed enough message to your patients. We wrote all this. Finally, we came up, in our 3-4 years review, 80% of the accusations on doctors were we found that there's no fault, no error. 80. Same in states, I saw the data. 20%, there is some problem. Of this 20, again, 80% of it, it's mild problem. Simple lack of communication, lack of clear communication, lack of clarity, and documentation, failure to document. You have done it, but you followed the labor, but the partograph is not filled. So how can we tell how you followed the mother? So communication and documentation solve a lot. Then the remaining very few, 5% or so, that shouts a lot in the media, it shouts louder. The 95 good doesn't shout. So that's saddening part. But the community as well should encourage doctors, should respect nurses, and understand the good work they do, the sacrifice they made. Think of COVID, think of Marburg now. We just had this epidemic a few weeks back. I mean, conflicts, remember, everywhere, health force is a frontliner. So we are soldiers, we are first responders, we are the first ones to respond, take risks. We treated diseases that we didn't know. Think of COVID. I was during state of emergency in Ethiopia's COVID, I was in the board nationally. We were scared, no reference to it. Nobody knows about this disease. We don't know what to do, but we're handling patients. So we belong to the community. The community is ours. And we strive our best to save lives and decrease disabilities. But sometimes one of us may err. So that, and during those times, I think it should be seen like any other, disciplines. And unfortunately, again, I can say 1% or less, we found serious breach of conduct and malpractices. But overall, you have to see the 95, 99%. Yeah.
Very important points. Thank you for sharing that. Very very serious and very concerning things to really think about. But like you said, documentation extremely crucial. I know most of our friends, who have who now practice medicine, whether it's in the US or in UK or anywhere, they keep telling us that most of their day, like after work, they have to stay and do their documentation. That is actually what takes so long from the work they do. So it's very important. It's safe for the patient, it's safe for the physician, so it's a good practice. But yeah. um so not only those things, but you're also you're also a board member of Addis Ababa University Senate member, and you're also a board member of University of Gondar, which are huge institutions in Ethiopia, teaching institutions, and they have teaching hospitals attached to them. And I know because you have two older daughters, and then a son. But for a very long time, I remember you bringing your daughters to the department, and we used to know them when they were little kids and everything. And you encourage women so much, because I have benefited from that as well, and my other colleagues, female colleagues, can all attest to the kind of person you are when it comes to supporting women. So with those big roles, being Senate member and board member at one of the two biggest and oldest institutions in the country, how do you influence and use those positions to encourage more women to come into, whether it's med school, whether it's surgical specialty, whether it's leadership position?
Yeah. Thank you. I strongly believe in equality of in gender equity, but with different roles. I'm a father. My wife is a mother. These roles you can't interchange. But as humans, we are equal. That's as simple as that. So with differences, we have we have similarities as well. From that baseline, if you empower women, they can achieve better, just as I empower men. I don't treat them a special way, but give what you give to the others, make them comfortable, understand them, provide comfortable environment, they can excel. And I've seen that in many. You are one example, and many more. Sometimes when we joke, this is a joke. I asked my students, by the way, now the undergraduates outnumbered the female undergraduate students outnumbered men at Black Line. This in front of our eyes. When we went Gondar, in my batch, out of 60, we had 5 female medical students in my classroom. This is Marta, Hannah, Gize, Galila, and Yodit. Now, when we arrived at Gondar, they said the female batch, because there are too many females, 5 out of 60. Our name was the female batch. Our seniors, no female at all, even, at all. Therefore, now sitting there, good, I can say, not easy number, 70%, close to 70, our undergraduates are females. This is, fantastic in Africa to see this right in my age, compared with my batch. There is big shift. Of course, still residency and fellowship is dominated, male dominated, especially orthopedics, but good numbers are coming. If the base is outnumbered, the apex corrects. And in the classroom, I asked them, how did fertilization happen? They tell me all this embryology and science, zona pellucida, so and so, the reaction when the first sperm strikes the egg and breaks. Then I said, what gets into the ovum and what stays outside? They mentioned all the organelles will stay outside. Only the genetic material gets into the ovum. Okay. Then I said, how come you don't, shout about this louder? You women yourselves. You said the organelles, all organelles, and the cell membrane, internal organelles, they stay outside. Only the genetic material gets into and combines with half of the genetic material of the mother. And they use the maternal organelle machinery to this gastrula, morula, or this stage of cell division. So I said, the ATP house, the energy house of every cell is maternal. So mitochondria is maternal. You didn't get your mitochondria from the father, from the sperm. No, it stayed outside. So at cell level, the powerhouse is from the mother. Cells make tissues, tissue, organs, the organism. So every mitochondria that we see in the world is maternal. There is no power contribution from the father. So if someone or a male says, I'm powerful, I'm dominant, so and so, yes, good, you got it from your mother. That should be the answer. Therefore, I should please Ananya very much today. This is a simple example, known fact, which many don't notice. Mitochondria is maternal. Every energy, even at cellular level, powerhouse of ATP came from the mother. Then the other thing in orthopedics fascinates me is the men, I read Bible, so men came from, God made us from soil. We are created from soil. So it's dirty. So you guys, you came out from surgical theater, from OR, sterile field. Under general anesthesia, God made the man sleep and took a bone. Just we followed, it starts with orthopedics. He took a bone from a side of the man. You beautiful came out from sterile or sterile field. That's why you are very clean. Always you advocate for being clean. You hate dirty things, so and so. We came from soil, so you have to understand us. So you have to forgive us sometimes when we mess the house, when we are a little dirty. You know, it's our nature. We came from soil.
Yeah.
You came from sterile or field. That's big difference. So um, these are some of the jokes we debate. But behind this, there is big philosophy. Um, to elevate the inequality, I use these notions. Then people get shocked. Yeah, even med students, they read it, they passed the exams, but they couldn't focus and say out mitochondria is maternal. Yeah. Isn't it? Isn't it? They say. Yeah. So somewhat this will humble us and discipline us. That's why I quote it. Okay. This soil versus sterile field. You came from tissue, I came from soil. That also, humbles us. Having said this joke, when you come to the truth, medicine is demanding profession. It's being an average student is not enough. It's demanding. Out of 5 levels, you should be level 4, 4.5, or 5. Level 3, 3.5, you can't be medical student. So these are tough students, very competitive, and they join this. And once females with the setup in Africa came out through all those obstacles and became medical students, for me, they are my heroines. So I will emphasize watching them, coaching them, and usually with, I think by nature, I easily understand females. That could be because I don't have a sister. I have one brother, as you know. So I'm open for that missing part to dialogue, understand, dig out women. And maybe because I have a good wife, or maybe I have a good mother, and my grandmother, I mentioned you, that may influence me. I clearly well conversate and easily communicate with women still than men. So that's my preference, and I have respect. I told you this is a tissue originating creature, me from soil. I have that respect. And they are usually caring. Medicine it needs caring heart. So for that nourishing and caring heart, the women is, I think, in my view, closer than men. So even studies in Gondar published showed that they may underperform during undergraduate years, anatomy, physiology, biochemistry, so on. But later clinical years, females perform better. That's well seen. And surgeries published everywhere. You can read nowadays. Caring, listening to, being humble, patient, caregiving, nourishing is closer to you than us. So these are factors that make me decide, to empower women more. That's why things I've done with you, I did. To talk to you, make them be approachable, listen to them, and provide few things and show the way they can do it. Daughters, my daughters I use them, I tell them, you are also my sisters, because I don't have a sister. So our relation is like that. We talk details, no secrets, we talk everything. And now the little son is an ingredient. He always says, me and Baba are brothers. We watch you, we take care of you. And this way we go. Yeah. Yeah. These are areas coming to these boards and senates. Wherever I go, I don't know if I don't want to boast, but I try my best to make women understood well. and voice on their behalf. And in decisions, I want to try dig deeper, and even if there are mistakes like being dismissed or fired or punished, so and so, a different eye, looking it from different angle, is my option usually. Otherwise, I work with Senate and board. Gondar is now big, big, big. It's not a university; it's a city. Addis now is autonomy. Tomorrow we'll wrap up our 75th anniversary. Tomorrow and Sunday. It's an oldest institute, renovated in many ways. So the Addis University you see now is completely different. From East Africa, it's #1 institution, always top 10 from Africa, and very competitive and with huge legacy. It's the father institution to many others. And Gondar, same equivalent, completely now booming in all aspects. Added to this, recently I joined Arbaminj Hospital Board again, a third one, and another big hospital just inaugurated and started to function. They don't keep me very busy. They only ask me things that I have to do for routines. The good thing about the parliament or other boards, so and so, they don't bother me a lot on routines. They give me specific tasks that need me. That saves a lot of time from me. So this way, we proceed. But the view with this current number of medical students in Ethiopia, trust me, in few years, in every specialty or subspecialty, our numbers will be equal, like the population number. Ethiopia is 1 to 1. So male and female, number wise, roughly it is 1 to 1. That should be reflected in 1 to 1. Maybe for you, subspecialty and other high-end careers, because you early on you engage in raising children. That's another big degree in itself. Every child, that takes a lot of task. It's a different call, big call. Always you should count like that one as an additional master's or PhD or whatever subspecialty in itself. So that shouldn't be forgotten. Yeah.
Yeah, I love that. If not more than the degree, to be honest, sometimes raising kids is not,
Sure.
it's not a
Sure.
joke.
I always tell my wife, if you go to work and if I stay home, I don't think I will handle it for a week. It's tough
No,
call.
you will.
Tough call. Yeah, yeah, yeah. Imagine my son was breastfed for 5 years almost. So,
Listen.
and put Brooke there and imagine what two of us will do in the house. Yeah.
Yeah, more work for mommy. That's what's gonna
Yeah.
happen. Yeah, but it's very true. And I think as a country, we need to be proud that it means the environment has been safe enough, because even safety was a question for a very long time for females to go to, girls to go to school, even access to basic sanitary products, restrooms, and everything, even at school. So it means there's a level of safety that we've
Yeah.
been able to achieve as society for women to actually thrive in this way. I mean, we still have, some work to do, especially in areas where we still have civil unrest and things like that. Women and older people, children, older people, and women are disproportionately affected by such things, but it is very encouraging. Um,
And
so,
actually, we
yeah.
should mention here, Anani, the exemplary role of our country's prime minister shouldn't be forgotten. He deliberately involved 50% plus of the cabinet should be from females, and he including the president for first time. So He stick to that rule. He makes sure always in big decisions keeps that normal population proportion of 1 to 1. That is unusual in Africa. So now look his cabinet, you can count one by one. I mean, big institution leaders like telecommunication, so and so, bankers. These are big CEOs, and these are women, and they deliver the best. Yeah.
100%. And it goes a long way for a little girl to see a woman on TV in such huge positions and giving a speech and, doing all sorts of stuff. And, it tells her that, oh, someone like me can be in that position as well. So I can also do it. So it gives you a dream to work towards. It's inspiring. So, yeah, thank you for pointing that out. So when you were talking, you mentioned about the Bible and everything, and I know you're a very you're strong in your faith. And a lot of people, especially when you're in the scientific community and then when you're advancing in career, it's, you know, putting your faith out there is not necessarily encouraged. If it's not directly discouraged, but it's not necessarily encouraged, right? But I always see you celebrating it, and I see it in the way you lead as well. I can see the direct effect of it. So how does that influence you? And do you advise people to lean onto those things, whether as physicians or as even students and doctors, especially when we talk about mental well-being and we are seeing high rate of dropouts, a high rate of suicide among medical students and the young population? What do you think the role of faith would be in that?
Yeah. Thank you. For me, I treat humans. I'm a doctor of, I'm orthopedic surgeon treating humans. And in my belief, I believe humans are made by God, created by God. So they have owners. It's with that level and degree that I credit and view humans. They have owner, they have manufacturer. So I'm a technician helping that product, but accountable to the manufacturer. So, he watches me, he asks me, I should do my best in handling his product, his creature. So if you have no problem with this view, the rest is easier. Then it's from this you can stretch out. What was Jesus doing? I mean, he came, he was doing miracles left and right. These miracles are grouped usually in 33 groups. Many miracles he performed were grouped into 33 groups. And of these 33 groups, more than half is health related. It's like healing a deaf, healing a blind, making a give us crippled patient walk straight, healing a paralyzed, name it. I mean, half of it. 16 out of 33. Forgetting, if you add mental illness like demonic possessions, this confused sometimes, the list is long. So Jesus engaged a lot on physical healing directly. And from one of the 4 gospel writers is a doctor, is a physician. Luke is a physician. So he was writing clearly in detail about healings and diseases than John, Mark, or Matthew in a different way. I think Jesus included this physician deliberately in the crew. So healing is emphasized very well in the Bible. Humans needed healing. And that time, during the time of Israel, during the time of Jesus walking on the earth, the priests were acting like physicians. So when Jesus heals, he tells them to show their healed issue to a priest. he always counter checks with the existing system. Healing goes now, I believe, still by the name of Jesus, but always, again, like Jesus respected those guys who claimed they are healed, they should check their healing with the modern physicians. You can't just stop taking insulin because a prophet or somebody said, a pastor said, you are healed and stop it. You'll die for sure if it is a lie. You should go and check with the modern system. If you are healed from HIV, go and check, show us you are negative. So Jesus definitely, the blind man, remember, he opened his eye, sight returned. He said, go and check, show this with your priest, immediate physician. So patients should check. We should mention this. In ethics board, several came. Pastor so and say, you are healed, but my son died. They come. So patients should check with their existing modern physical health system that they are genuinely healed. And if they found that they are negative or disease is gone, praise God. If not, continue your treatment. This is my advice. And faith, we work with God. That's my belief. I say we treat, God cures. My role is to treat. To cure is his role. Hippocrates said this oath, by the way. Exact words I'm quoting from him. I treated, he said, God cured. So my job is to treat the best I can. The outcome, leave it to God. And I improve myself always. I strive to improve myself. And always I think that my last referral destination is God. Things that I couldn't solve, advanced, complicated, difficult, impossible. The last senior I consult is God. The last hospital institution I refer my patient is not medical tourism hospitals. Beyond that even is God. So I believe in miracles. I believe in God's intervention. I believe I'm handling his creature. And I believe I work with him. So I have no problem in integrating and working with him. So I love that our God loves healing. One of the verses I have to quote for you that John mentioned. John is the favorite disciple to Jesus. He's always towards his heart. That's why Jesus said at the cross, take care of my mother. Out of the 12, he chose him because he's very friendly, special to him. And by the way, he's the one who died natural death at the age of in 90s. He died. The others all were murdered. They are martyrs.
Yeah.
But this one enjoyed, and he saw the end of the world, even at the age of, gray hairs. And he said, 3rd John, it's only one chapter. Number 2, he said, my loved one, it is my prayer that you may do well in all things and be healthy in your body. You see?
Yeah.
So it's God's will that people stay healthy. And God's people wish always for the best of health in there. So there is no problem. Our God is a healer. Our God is he's positive that we stay healthy and active and alive. He hates suffering. Suffering is not welcome. It's not his intention. Therefore, we work together. There is, I always imagine if I were in other profession, sorry, it's not to offend anybody. I doubt I can enjoy the enjoyment I enjoy now. Because I always feel I work with God. I responsibly handle his creature. And in my deficits, he's my capability. Yeah.
Wow, I love that. That's very important. because you can, sometimes as humans it's easy to lean into our ego and think, oh, I'm doing this. And especially when you become a surgeon, where you open up a person and see the inside and do whatever you do. A lot of people can't do that, don't have the stomach to even look at blood and stuff like that. It's easy to get over your head and feel very egotistical and forget that you're just an instrument. It's
Yep.
like, it's the way we use an artery to stop bleeding. That's how God is, using doctors to treat, like you said, his children, his creation.
Yeah.
So I love
This
that.
God fact, this phase factor, you see sometimes, some patients you thought will not stay weeks, months, they are still there. You you can't explain it. Some patients you were sure and confident you fix it nicely, they are not there. So things are not in your hands. You just do your job. You treat, leave the rest for him. So there is always, I mean, um, he's the manufacturer, the owner. He owns all these billions of people. He is the one who owns, he is the father of everybody. No discrimination. He loves everyone. Therefore, I treat his people, and we should take this humbly. Imagine working with him and treating his people. It's with that level we should carefully handle humans. Yeah.
100%. It keeps you accountable. So we talked about so many things, and you've been involved in conflict, you've been involved in war, like even a long time ago. I wasn't even in med school when you first involved in the first war as a doctor, and then as a surgeon as well. A lot of pandemic, like the COVID, the Marburg outbreak we have right now. So you have, and then all the other leadership things you've done. There's so many things that you've went through in life, and so many experiences. Were there any, have there been anything that stood out for you that's just like your grandma, just something that stood out for you that changed you to the core, whether it's for good or something you just learned from, or something that's just so funny that you always think about? Well, has there been, not even maybe three or four experiences, but share with us some of them?
Yes, imagine a few days after graduation, our batch was asked to go to the war front during the 31 war. So I was class speaker. The fax came from the prime minister office to the dean's office. The dean called me and I should read this in the class. Then the batch said, as far as we are together in groups of 5, 6, 7, no problem. So they spread us in the 4 big fronts, and I was in the Baduma front. So then this is this is a different world. Civil practice is completely different world from military practice, especially during conflict. So here rules are different. Triage systems are different. In Gondar University, you treat patients until last breath. Here, time is of essence. What's counted is how many lives you save during the time you are given. So you may not waste 8 hours in corrective amputation of 4 limbs lost, where your patient in the end dies and you end up with nothing, versus if you save in those 8 hours some 100 pneumothoraxes, and these soldiers will fight back tomorrow again. That's how you calculate. So the thinking is different. So the ethics, the thinking, the triaging system is completely different. So I learned lots of things there. That's where I decided to actually pursue orthopedic career. I saw the gap. There are fractures. This is Africa. This is end times. This is era of resource competition. This is era of population increase. So my gosh, I said we're not ready. I don't think that time there were even enough finger counted orthopedic surgeons. Then I came, I decided. Initially, I was to join general surgery. Actually, I joined, but the orthopedic gap was so big. And Gondar, as you know, is once during German times, it's known to be best orthopedic center, one of the best we have in the country, big wards during the Civil War. But once the Germans left, there was no orthopedic surgeon at all. So I was the first lecturer hired officially as orthopedic lecturer back from the war. And I was very happy and came to Blackline. We had some good exposure. Volume-wise was big, thousands of shoulders, no problem. But in the sophistication of procedures, Professor Raphael really helped us a lot to go beyond, the basic open fracture care. Then science kicked in, then things came up, joints, cure hospital, it went, straight away. So now, in Ethiopia, I'm not worried of imminent. I'm not worried of the orthopedic career will bouncing back to the old days. It will advance. Patients see changes. Youngsters pursue different subspecialties, and every surgery we see in the books and elsewhere will be practiced in Ethiopia. No problem, no question. In fact, now back to the question. After seeing that, I decided, I calculated for myself, where should I position myself? Should I be pediatrician, internist, gynecologist, general surgeon, orthopedic surgeon, psychiatrist? I saw all these things. Then I prayed actually, and it's the next to decide after joining medicine is maybe tougher than joining medicine is deciding which specialty to choose. It's a serious decision. One day you decide one, then you change to another, then finally I sat down and calculated. This is the world ahead. This is a world of trauma. With all these traffic injuries, with less than 2 million cars, we are number one in fatality. Finland has more cars than population. The number of cars is big. It outnumbers the number of Finnish population. You remember Dr. Finta. So we always talk. Just we in Addis, less than 2 million cars in Ethiopia, but 5,000 deaths a year and so many morbidities. It's an area we should work hard. Even with good roads infrastructure is exemplary, not this and elsewhere, but still road behavior and speed and habits we exercise on the roads are, causing lots of fatalities. So there is always injury, conflicts come, resource competition comes. The same 1 million kilometer square land, 1 million kilometer square land, more people on it. God's will, our population doubles in our time. Can you imagine that? And if we have this much injuries with 2 million cars, what will be the number of injuries when we have 5 million cars, which is achievable in few years? So I tried to position myself, where is my influence maximum? So border conflicts, this is strategically located country. Issue of dam, issue of seaport, so and so. So our historical enemies, so and so. So construction, motorization, urbanization, name it, falls. Now, when I joined medicine, our life expectancy was 46. Now it is 64. You can change the numbers. So what does that mean? Many falls, many cataracts, many Parkinson people fall, people get aged, many joint replacements with degeneration, discs, so and so. So I taught all this left, right, calculated, and the interest is there. To be a surgeon is my interest, but which piece of surgeon, which subspecialty was an issue. Then I opted for orthopedics. This way, I'm very happy, very lucky. In short years, I've seen a lot. Most of my dreams came true. 2 or 3 are left, which will be very soon achieved. I think it's my prayer I will achieve those. We can readdress back this question because I'm afraid we may be out of time, but let me follow you. Just lead me. I can talk more on this.
Yeah, that's great. Those are really good points. I mean, it's just what stood out that changed your course. You becoming an orthopedic surgeon is the turning point to everything you are right now. So it is quite a significant milestone, and thank you for sharing that story. So we really have come to the end of the conversation, really, because we talked about a lot of things. I love it. I always enjoy talking to you because you have this way of explaining things, making it so simple and funny to think about now that your daughter is in med school. Young people like her, or maybe surgeons in training, or just literally just anyone in Ethiopia, really, because you're like the you can be like the uncle of everyone, right? So that gives us advice. So what would your last advice be?
My for medical students and those in medical career, my first advice: you joined the best discipline ever possible. You joined because you earned it through hard work. You joined where not randomly anybody joined. You scored above average. You are not average student. You are more than average. So the first thing I mentioned is just be proud of yourself. Just thank God you made it. Many couldn't achieve this. One. Number two, I tell them to think globally. Now we used to teach and produce graduates to serve in the nation of Ethiopia. Now, few years back, I changed that. We produce practitioners who can serve humankind globally. So I tell my students to think globally. They can work anywhere. Just be competitive. Get the best knowledge you can, retain it, practice, and think globally. There are many possibilities that were not there before. Three, I tell them to be confident, to excel in their. They treat humans. You are not building a bridge. You may make a mistake, then abolish it and start it again. Get punished, then reconstruct a new building. It's not that way. If you lose life, if you are a reason for life loss, you can't bring it back. So learn carefully. You are learning on the way about yourself. When you treat a patient, think that you are treating yourself. You are treating your son, your daughter, your wife, your sister, your parents, grandparents, so and so. Put your shoes in that position, in that patient's shoe, and talk to that patient in that way. That way you can relate easily. Three, medicine fascinates. Get fascinated all the time. It changes. It keeps on changing day by day. New discoveries all the time. It's big industry, and it's a noble profession. I tell them don't listen to the current status. Don't internalize negative thoughts, negative readings, negative posts. Think globally, and also finally I tell them be patient. The problems we face and mention will not last long. I believe they will change very soon. With development, with nations' economy rising, things will change. Therefore, be patient. I tell them, calm down, be patient. Just do what you have to do, and wait for the good time. So that is patience. Overnight, you can't build a career. Medicine is a long overdue career. So I ask for their patience. But after doing all this, I guarantee them they will be satisfied in the end, this or that way, here or elsewhere. So medicine is a proven noble profession. We treat human beings. We work with God. We treat His creature. And our satisfaction, oh my God, is immeasurable. So that's my advice. Yep.
Thank you so much, Prof. Thank you for coming on. That was a great conversation. I know when it's released, a lot of people are gonna be glued to the screen and listening to this. So it's always an honor. And yeah, I hope to have you back soon on a different topic potentially.
Thank you, Anani. I always, as usual, I say you are the very few handful of mentees I met, and I saw this before. I told you previously what you are doing, what you are. For me, already I saw it years back, and it happened. I'm not surprised. You may surprise me later on by doing more than this. Still, there is a way, another step, another stair you have to climb, but you are doing so good. So far, it's so good. I'm so happy. And I will tell back, we have female residents in the department. Actually, our chief resident now just elected. Last one is a female resident. So I will tell them and the others that where you are, always I mention you, I quote you. I mean, if I start calling name by name my students, I may disappoint some. I love all of my students, and most of them are at a very influential positions, doing amazing jobs, and excelling in several ways, and that always keeps me proud. Always there is a news. If I open my phone or any social media, they do something somewhere that fascinates me. And keep doing your hard work, and wish you all the best. Excited to see the next chapter of your life. You are a good mom, good surgeon. Now look here. I mean, this is the small journal writing you started. Look where it is now. Yeah. Keep up. Thank you very much.